And with this, it is 1 o'clock. I wish you all a wonderful, wonderful good afternoon. Dr. Manoj, good morning to you. What is the time at your place? Have you slept throughout the night or not?
Namaskar. It's 1:30 in the morning here in America. The excitement is so great that no, I have not slept. I am anticipating great conversation, especially with all our DTOs, and then Gurudev and so many of the staff, TBHVs and others who have joined. So delighted to have so many people. इतने सारे लोग आ रहे हैं, अपनी बातचीत होगी और अपन देखेंगे, सोचेंगे कि आगे कैसे बढ़ सकते हैं.
Absolutely, Dr. Manoj. And all those who have joined us right now, and many are still joining, all the DTOs, you wonderful people, and the STOs are also there, and your NTP staff is also there. SETI has always said that we work towards, making the DTO and his team stronger. Today, our approach is, all you wonderful people in the NTP program, is to unite the entire country and put every citizen with you. कंधे से कंधा मिलाकर अगर हर एक नागरिक आपके साथ चलेगा तो आप सोचें कि आपकी जो अप्रोच है उसको कितनी गति मिलेगी, उसको कितनी स्पीड मिलेगी. So that is the objective today. And
very much so, very much so. And this idea and concept is really remarkable, that we are moving towards getting the common public now into the fold. We know that Nikshay Mitra has done that in a big way. We know that there are multiple programs that are there from the government, from CTD, wonderful program and projects. And this is the approach that we want to do, is to get TB awareness and TB elimination in the general public and the general fold. So Commodore Raman, very much so on the right track.
Absolutely. And to all the audience who have joined us today, we are writing history. Today's date, 25th of January, 2023, we have to keep in mind. Imagine the scenario that I am going to ask you. You may visualize it, that the way we eliminated polio from this country, there was a mission, there was a kranti, there was a Jan Andolan, there was participation. We all know that if everybody participates in this country and everybody's emotions and strength gets contributed, we will achieve great things. So, Dr. Manoj, if I was to ask you, COVID, today, a normal person on the road is more aware of the symptoms of COVID, as much as a doctor. So we all started, going and visiting the doctors on our own because of the awareness that we had. So if that kind of awareness comes in the TB program also, in every citizen's mind, how do you think it'll shape out, and how will today's session contribute in that direction? You're on mute, Dr. Jain. Okay, so that is one question. And second question that comes to my mind is, there is a stigma attached, to the TB program. To the in the mind of the TB patient. We want the TB champions to come forward, but नहीं आते हैं. आप imagine करें a situation wherein people will start coming forth on their own. Imagine a TB champion walking into the office of the district tuberculosis officer, that I want to be a TB champion. I want to be recognized as a TB champion. Imagine if that kind of a situation can come in. And at this point in time, yes, Dr. Manoj.
Yeah, absolutely. And that is what awareness can do. आप बातें कर रहे थे कोविड के बारे में. Everyone knows the symptoms of COVID, but not many people know the symptoms of TB. And it was remarkable what COVID has done to the mentality of the general public, not just in India, but throughout the world. We want to use that to our advantage. We want to let people know that there's a respiratory illness. I just had a conversation with Ken Castro from Emory University today, and I talked to him about the G20. In fact, he told me about G20 and said that it is a priority to be talking about respiratory illnesses there, which brings in COVID, but then also brings in TB as a priority. And so this is how we're going to reach the general public to be more aware about COVID and be more aware about TB. So that is what is quite remarkable.
Very nice. Tell me, Dr. Jain, you are an infectious disease physician. What has been your journey? What has drawn you towards, our country? And, I would like to share with all my audience that you get up at 4 o'clock in the morning and 4:15 in the morning. And whenever we are interacting with the DTOs here and there and the program is going, you're always at it. What drives you? What is your passion? What is your dream? What is your vision?
Yeah.
What do you want to see?
See, Commodore Raman and my fellow DTOs, in life, we can live an ordinary life. We can live a good, comfortable life. But there are chances that we all have that we can do something beyond, that we can do something that will change the lives of others, not just ourselves. And I had this conversation with Gurudev, and you can see how Gurudev works and acts. And so in emulating great people like him and others, there is a sense of drive, a passion. And it is really that igniting of hearts that moves me each morning and each evening. Late in the evening, like tonight, early in the morning as when we have many of our conversations. And imagine it doesn't cost us anything, and yet it gains us so much. And I saw the same light in so many of our DTOs. Throughout the past 15 years, I have visited number and number of districts and DTOs. और हर बार मैं हर एक नया डिस्ट्रिक्ट में जाता हूँ, I make sure कि मैं वो DTO से मिलूँ, बातें करूँ, और TBHV से मिलूँ, और गांव-गांव भी जाता हूँ तो बातें करता हूँ. और जब कॉन्वर्सेशन होता है कि अपन क्या कर सकते हैं TB elimination, there are a number of DTOs who light up, who have that energy and drive. What we want to do is to channel that, bring that into a way that we can harvest that energy, productivity for TB elimination, a common goal, a common purpose, and a common trajectory, TB-free India.
Very nice. Thank you so much for sharing your dream and vision. And मुझे जानने को मिला कि आपको क्या पैशन है जो ड्राइव करता है. डॉक्टर सलिल भार्गव, क्या आप मेरी आवाज सुन सकते हैं? मैं आपका भी कुछ व्यू जानना चाहूंगा, लेना चाहूंगा. जैसे ही आप नेट इन हो, मेरी आवाज आप तक पहुंच रही हो, तो आप प्लीज. यस डॉक्टर सलिल भार्गव, को फाउंडर ऑफ सेटी along with डॉक्टर मनोज जैन, स्वागत है आपका. डॉक्टर सलिल भार्गव, आप खुद एक डीटीओ रह चुके हैं
जी,
और आप मेरे ख्याल से लगभग 30 साल की आपकी प्रैक्टिस तो अब तक हो गई होगी टीवी प्रोग्राम में पेशेंट्स देखते देखते, ये मेरा अनुमान है. मेरा आपसे एक सवाल है कि अगर कुछ ऐसा हो जाए, कुछ ऐसी सद्बुद्धि हमें मिल जाए कि हर एक पेशेंट जो टीबी का है, अगर वो टीबी से ग्रसित हो और उससे कोई उसका पड़ोसी पूछे, भाई कुछ दिन हुए आप नजर नहीं आए, और वो कहे हाँ कुछ नहीं यार, थोड़ा टीबी हो गया था, कहे क्या ये सिचुएशन हमारे देश में आ जाएगी? क्या ये स्टिग्मा हम खत्म कर सकते हैं? क्योंकि बीमारी तो लाइलाज नहीं है, पूरा इलाज है. तो अगर कुछ ऐसा हो जाए आज के सेशन से, गुरुदेव के शब्दों से, कि हम प्रेरित हो जाएं, हमारे दिलों में गुरुदेव राज करते हैं कि अगर कोई व्यक्ति किसी से पूछे, भाई कहाँ थे, 3 दिन नजर नहीं आए, वो कहे हाँ कुछ नहीं यार, टीबी हो गया था। आपके व्यूज, ऐसा हो जाए तो क्या हो?
कमोडोर रमन, हमारे टीबी प्रोग्राम का एक ये मेजर प्रॉब्लम है। आपने जो कहा है, हम लोग टीबी की बीमारी को अभी भी छुपाते हैं। जैसे सर्दी खांसी होती है, जैसे निमोनिया होता है, जैसे पीलिया होता है, जैसे डायबिटीज होती है, उसी तरीके से टीबी एक बीमारी है, और जो अब पूरी तरह ठीक हो सकने योग्य बीमारी है। तो आप जो बात कह रहे हैं, आज हम जिस वक्तव्य की तरह, जिस डिस्कशन की तरफ जा रहे हैं आज गुरुदेव के साथ जो होने वाला है, भगवान हम सबको वो शक्ति दे, वो ताकत दे कि हम सब बता सकें कि हाँ, टीबी की बीमारी एक साधारण बीमारी की तरह है जो जल्दी ठीक हो जाती है और जिसका इलाज करने से पूरी तरह ठीक होती है। इससे डरने की, इसको छुपाने की आवश्यकता नहीं है। मुझे पूरी आशा है आज हम इस चीज की ओर एक कदम आगे बढ़ जाएंगे।
Wonderful. So I would just like to once again to all the participants who are logged in right now on Zoom, on the chat, may I request the staff to put the YouTube link also. You have understood what is going to be talked here. We are trying to make it a kranti so that every common man gets to hear Gurudev. So please share this link. We are parallelly showcasing this program on YouTube also live. So all your WhatsApp groups, your personal family WhatsApp groups, your children, their WhatsApp groups, colleges, gram panchayats, villages, communities, please make this link viral so that everybody in the country gets to expect that maybe there is something which is going to happen which will make everybody in the country feel TB. It is just a simple disease. So now I will come to Dr. Manoj. And in the meantime, I would be looking forward to a signal from our IT staff that the health minister's video is okay with us. Dr. Manoj, I have a question for you. And maybe if I'll get the time and opportunity, I'll put it up to the Gurudev also. From you, I'll be looking, a scientific and a technical answers, and from Gurudev, I'll be looking at, spiritual depths. Tell me, a TB champion, and this question, what I'm going to ask Dr. Manoj, to all our participants, please hear me out so that you make the YouTube link viral. All these questions, answers, if they reach the entire country, it will help us a lot. A TB champion is a great tool, is a great way of spreading awareness in the community from where he comes from or she comes from, of convincing other people that the disease is very simple. It is, curable. It is just that the treatment is a bit longer. And it is a way of telling the community that the patient not only needs medication, he needs hand holding, he needs counseling, he needs nutrition. That's the best way of doing it through TB Champion. But our TB champions are very simple people from very humble background. They are not, digitally sound. I can't, bring them here. But their children are very smart.
Very smart. Exactly. Very smart.
Their children are all digitally connected. Their children are the youth which is leading this country. Their children are ready to bring a revolution to this country.
Yes.
Their children are willing to share the stories that, my father, my mother, my relative had this problem, and simple. And their children are willing to tell other children, if there is such a patient in your family, bring them to the government fold, bring them to the TB program.
Yes.
Dr. Manoj, if we do this, if we shift our focus from TB champions to the children of the TB champions, how will this approach work? And
I would absolutely, and I would say add TB champions children as part of TB champion 2.0. Think of the children as 2.0 for TB champion. I want to share a story, Commodore Raman and our fellow DTOs. About 1 month ago, I was in the slums in the poor areas in Indore, in Khajrana. मैं वहाँ पे हर घर जा रहा था, घर घर देख रहा था, बातचीत कर रहा था लोगों से कि किस तरह से उनको टीबी का इलाज हो रहा है, उनको what types of problems they were facing. And we encountered one woman, and she talked about her illness. Then we asked her that were you willing to talk about it to a broader audience? And she was not. She looked at her mother-in-law and she quieted down. But then a child, her 14, 15-year-old daughter came forward and she said, "Main baatein karungi. I will talk." And that made all the difference and brought confidence. We didn't need to reveal any names, but the children can be a TB champion 2.0 who can then take the message forward. So Commodore Raman, I think that's a wonderful idea. I think these are innovative approaches that we can take on what we're already doing, such as the TB champion programs and a number of other programs.
Thank you, Dr. Manoj, and to all the participants right now who can hear me on Zoom as well as on YouTube. Once again, there is a request. Whosoever has got the link of the YouTube, please keep making it viral. Because if I will go and tell the TB champions, or if I will go in the village, or if I will go in the community and tell the family, the children of TB champions, it will not have so much effect. But once Gurudev will do it, I don't know what mesmerizing effect he has, but he will reach deep in your hearts. He will reach deep in the hearts of the entire country, and the message will go. Imagine if tomorrow onwards, automatically there is a revolution in this country, that all the children and all the TB champions, they start coming forth. Yes, we have experienced this. So thank you so much. And Dr. Manoj, I think it is time for me to introduce the health minister. And he's been very kind because, Gurudev's program was going up and down. So the health minister, and I'm very thankful to him, Dr. Mansukh Mandaviya, he said, in that case, I will record my message and send, because, Gurudev was supposed to be at Tirupur in the morning. He's gone by the helicopter, and he said he'll come back so that, he can be with our program. But just now I have heard that the helicopter has made because the weather is bad, but he's joining us. So before I bring in the health minister, it is such a pleasure for me. It is such an honor for me to, give a brief background on him. And there was so much to talk, and there is so much to talk about this gentleman, but I have picked up only those things which are relevant to the session today. Okay. So thank you, Dr. Mansukh Mandaviya. We welcome you virtually amongst us, Minister of Health and Family Welfare. He has been listed at number 25 by Indian Express amongst most powerful Indians in 2022. Not because he has got a lot of wealth, because of the contributions to the society as a health minister that he has made, and also as in his previous portfolios. He is on the executive board member of Gavi. Gavi, as we know, is the Alliance for Global Vaccines. And we know that India, under the mantra of Vasudev Kutumbakam, we have distributed approximately 235 million doses to approximately 98 countries till the time I was last following. He is the chairperson of Stop TB Board Partnership. And Dr. Manoj, somewhere I believe Stop TB and you are also aligned. Or shall I hear about it now from you or later maybe?
Sure, absolutely. Stop TB Partnership is a international organization that works towards the common goal of eliminating TB. Dr. Sudanand Sahu is one of the key members there and has been a collaborator with us a number of times. So it is wonderful to have them. And then they work very closely with the Central TB Division and all of us. So a great organization.
Great. Dr. Mansukh Mandaviya was born in a very small village called Hon'ble in Bhavnagar, Gujarat. You will need a lens to locate that village in the map of the country. And why I bring this out is because a person from that background understands the problem of TB that much more. He is a PhD on role of Gram Vidyapeeths, rural schools, and that is what we're talking just now, of TB champions, of starting a revolution in this country. And he joined as an MP at the age of 38. And we are talking of youths joining this program. So here we have a health minister, very proud to talk about him. And he is known for his intellectual analysis and thought leadership. So may I request Edwin, sir, please. Yes, absolutely, sir. Please play his message.
Namaste. It is an honor to be part of today's virtual meeting organized by the Collaboration for Elimination of TB among Indians, the American Association of Physicians of Indian Origin, and the Art of Living Foundation. As some of you may recall, Honorable Prime Minister Shri Narendra Modi ji, a clarion call in May 2018 to eliminate TB from India in 2025, 5 years ahead of the global SDG target, added momentum to this mission to end TB in India. Many here would know that India single-handedly contributes more than 1/4 of the world tuberculosis burden. While TB can affect anyone, it is seen that it usually affects the most economically productive age group of society. The government is implementing an ambitious national strategic plan with the goal to achieve SDG and TB targets. The challenge of ending tuberculosis requires a multi-sectoral response to address social determinants like malnutrition, unemployment, stigma, etc. Various studies indicate that good nutritional intake and physical and spiritual well-being can ensure positive treatment outcomes. Although the efforts of the government are yielding significant results, community engagement can bridge the gap and address social determinants which will amplify the TB elimination efforts. For the effective engagement of the community in ending TB in India, the Honorable Prime Minister directed an intensified TB Mukta Bharat campaign which could involve all sections of the community along the line of Vasudhaiva Kutumbakam, the world is one family. The Health Ministry conceived the Pradhan Mantri TB Mukta Bharat Abhiyan, which would involve the community and thus support TB patient and help reduce stigma. The PM TB Mukta Bharat Abhiyan was launched by the Honorable President Srimati Draupadi Murmu ji in September 2022, and within 10 days of the launch, many citizens, NRIs, corporates, NGOs, philanthropists, political parties, and a few TB survivors and individuals from all walks of life came forward to help TB patients. And gradually, this became a movement. Pradhan Mantri TB Mukta Bharat Abhiyan, possibly the world's biggest social support program for TB patients, in an example whole world to follow. Under this Abhiyan, anyone can become a donor and called Nikshay Mitra. They can adopt people currently of TB treatment by providing nutritional, diagnostic, or vocational support. Thus, accelerating the response against TB and complementing government's efforts. In addition, the Nikshay Mitra is also encouraged to counsel the TB patient and Mitra or friend and be a partner in the journey toward the recovery of the adopted TB patient. The local administration supports Nikshay Mitra in prioritizing district and guiding on critical gap analysis and district specific needs. The support provided to the patient under this initiative is in addition to the free diagnostic, free drugs and Nikshay Poshan Yojana provided by the government. The Pradhan Mantri TB Mukt Bharat Abhiyan has already seen over 60,000 Nikshay Mitras adopting over 1.3 million TB patients. To end TB in India, we must move towards a world free of stigma and discrimination against persons affected by the tuberculosis. I now seek your support in India's fight against tuberculosis. With your support, we will eliminate TB from India just like polio. I invite you all to join Pradhan Mantri TB Mukt Bharat Abhiyan in the fight against TB. Become a Nikshay Mitra today and help a TB patient defeat TB and live life in dignity. In the end, I thank you all of being ambassadors of peace. May you follow the path shown by Shri Ravi Shankar ji and continues doing good in society and the country you are in. As we say, TB harega, desh jitega. Jai Hind.
Very nice, Dr. Manoj Jain. We heard a wonderful thing, address by the Union Home Health Minister. Your comments?
I think he was spot on. I think it's really important to see the conversation we had earlier, which is exactly what he said, which is bringing into fold the lay public and the TB Mukt Bharat, the TB Nikshay Mitra project has begun to do that. And that is so critically important. We saw that there's involvement of API, American Association of Physicians of Indian Origin. They are our partners in many of this, including Emory University. And so really important to keep in mind all of the priorities that our Honorable Minister has set forth.
Thank you, Dr. Jain. Dr. Jain, before I formally introduce you after the Health Minister to the entire audience, if I may request, DDG is there, he has joined us.
Yes.
And it will be very appropriate if we bring him now after Health Minister has spoken to us. And may I request you to welcome him and involve him in communication,
Absolutely.
conversation. What is his expectation from session?
Absolutely. So I want to introduce DDGTB, Dr. Rajendra Joshi. Dr. Joshi and I have had many conversations on a number of topics, and we collaborate, work together every time I am flying in and out of Delhi. His door is always welcoming and opening to me. Dr. Joshi, thank you so much for your leadership and for your hard work. Honorable Minister made several key points about a number of programs. How would you highlight them and put them into perspective for our DTOs and how they can move forward on those programs? Your thoughts on this, sir?
Thank you, Dr. Manoj Jain. Namaste. Good afternoon to all who have joined from India, and good morning to all those who have joined from abroad. So it is a great privilege and pleasure for me to be participant of this very, very important meeting on the eve of our Republic Day. See, today is a great day. We already had our Honorable HFM sir addressing the audience, and we are going to listen to the Sri Gurudev ji on tuberculosis. So I welcome on behalf of Central TB Division all the CT members, members of the AOL, general public, and our NTP family. So we have got a huge family of people working directly and also contributing, partnering, and helping tuberculosis. This is a great moment because tuberculosis elimination requires everybody. We want to involve each and everyone, be they medical, non-medical, general public. In tuberculosis, each drop counts to make it a big sea. Like our Honorable Minister correctly said, we have got a big burden of tuberculosis in India. Our country size itself is more, the population is more, the burden is more. But luckily, we have got a lot of people who are helping it. Like SETI is conducting already courses to capacity building our DTOs. Our DTOs and staff are really our backbone of our whole system, who are helping the people in the TB with the tuberculosis. And we have got TB champions for being a big partner, big contribution. So what I request all those who are listening to this is to see how you can contribute, how you can help. Each one can help. There is nothing like big or small. As a program manager, what is my problem? My main challenge is creating awareness about tuberculosis, improving the health-seeking behavior. We have seen that many of the patients, they reach the health system late. Once they reach, whether public or private, the program gives them free diagnostics, it offers them free medicines, even to the private patients. We give them incentives. We have got nutrition support from Nikshay Mitras. But if they come early, it will be easier for us to treat, easier for the patient, and easier for them to avoid spreading it to their near and dear ones. Tuberculosis being infectious disease, late diagnosis is detrimental not only to the patient, but to the close contacts also. Second, what Commander Raman sir brought out was about the stigma. It is very important that all of us who are literate, who are educated in whatever field, should work hard to see that the person with tuberculosis looks it scientifically correctly as just a bacterial infection, not as any curse, not as any karma. And he should be comfortable, his family should be comfortable, and the society should be comfortable in recognizing that there is nothing wrong. There is no need to hide it. So having said that, the Pradhan Mantri TB Mukt Bharat Abhiyan, which we started, Honorable President Madam was very kind to inaugurate it, and it has got a huge success. It shows that there are a lot of people who are willing to help tuberculosis patients in our country. So today's meeting, I am very hopeful that many more will join as Nikshay Mitras, many more will learn about tuberculosis, spread the awareness, and help us in achieving the goal of TB elimination.
Wonderful,
Thank
wonderful. Yes. So Dr. Joshi, you mentioned stigma as one of the key points, as did our Honorable Health Minister. It was a stigma to even talk about stigma in many times. People did not want to even bring up that there was a problem with stigma many years ago. In many countries, that is still the very big issue. And jab main slum mein jata hoon, jagah jata hoon, it is still a problem that is there. The fact that we're now reaching out to organizations such as Art of Living, that other spiritual, religious, Rotaries and others, do you think that the stigma problem will be better addressed? What do you think on that?
Definitely, because these are the people
Yes.
who can make a difference. See, we need people from the community like TB champions. We need the support of our field workers like STS, STLS, who are ASHA workers, DTOs, STOs who are doing a wonderful job. But we also need the other community people who actually to reduce the stigma, learn about TB, create a scientific awareness, and tell what it is. See, tuberculosis was, the bacteria was detected more than 100 years ago by Robert Koch. But still, if I feel that I should hide it, that means it is a society which requires to be created awareness, scientific part. Basically, they want to think about TB. Once you start thinking about TB, information is available at click of a mouse. Information is available with any doctor. Learn about TB. Please see that any person with tuberculosis, that he doesn't feel bad. Second important point now that I want is the AOL members and all can help is if they come across any patient with tuberculosis, taking treatment regularly is very important. Our success rates are very good. I am achieving more than 84% success rate across India. But for that, the patient has to take the treatment regularly. Usually it is about 6 months treatment. So talk to them, give them comfort, see that they take the medicine regularly, even if they are going to private or government. So AOL members can definitely make a huge difference.
Wonderful. Thank you so, so much. Commodore Raman, over to you.
Thank
And
you.
then we continue our conversations.
Thank you.
And
Thank you.
Dr. Joshi, we will have you come again in our conversations. And Dr. Salil Bhargav also, please add in as we continue our conversation and on how we can eliminate TB from our country.
Absolutely. So, DDG, Dr. Joshi, thank you so much. I have made a note. Absolutely, the point that you have highlighted, we will bring it during our discussion. Health-seeking behavior is your first concern. Awareness was your second concern. It is not a curse. It is not karma. It is not. It should not be there. Stigma, 100-year-old disease, but yet we are fighting. So, society is what we need to tackle. So, absolutely. With these 4 bullet points, we progress ahead in the session. And may I request the IT staff, Edwin sir, if I can have Dr. Manoj on the slide. Dr. Manoj, I have lots of questions to ask you. So first of all, if I may know about your educational qualification and background, so that, I know it, but I want all our participants to know, so that, when your opinion is sought, it matters. Please.
Sure, absolutely. So to share with our fellow DTOs, I am an infectious disease doctor. I did my training in Boston and medical school there, and then spent 3 years in tuberculosis at an infectious disease training. This is a part of the fellowship program that is beyond the residencies that is there. I was at CMC Vellore, I was at AIMS in Delhi and MGM Medical College in Indore during this time. So a good vast background. और इसके साथ साथ भी हमने public health degree भी करी. I was my knowledge in public health. So this was all part and parcel of a broader outlook of how we can work with diseases, because diseases are in strange ways, not just occurring in individuals. As a doctor, we think a disease occurs in just one person, but a disease occurs in an entire community. और जैसे अपन बोलते हैं कि टीबी बस एक पेशेंट में नहीं होता है, एक आदमी में नहीं होता है, एक औरत में नहीं होता है, एक पूरे परिवार में होता है टीबी जैसे होता है. And that is why I chose to do a master's in public health and continued my training and work in there as well.
So thank you so much. So we are now aware of the qualification. We are now aware of the background. I understand, and I have read so much of your work, and you yourself said that you have written also. So you are writing for which all journals, and if you can recount some of your writings, which are your favorites, I'll be most happy to share them with the audience.
Absolutely. So to become a better thinker and doer, one also has to be doing writing and contemplating as one writes. So I write for the Washington Post on health matters. One of NRIs named Dr. Atul Gawande is a phenomenal writer. And also he is a friend of mine from Boston. And so I also have done lots of writing during COVID as well. And in all of this was my passion, which is the work on TB and the work in SETI, which I will be sharing as well as our work in nonviolence and in the Jain tradition as well. Spirituality, nonviolence is very close to me, and that, in fact, what has drawn me very close to Gurudev in many of our conversations when he was here in US with us.
Why people, Gurudev and Sunil Gavaskar, everybody visits your house? What makes you so tempting and sweet that every bee gets attracted towards you? I want to learn from you, Dr. Manoj.
I think it's a common passion and drive that brings us together, and that is what I would like to share with everyone. So that is wonderful. Thank you.
In that case, I would now like to ask you, and Edwin, I draw your attention here. What gives you this strength? Edwin, can we go to the next slide, please? Where do you draw your strength from?
So it is people who I work with, collaborators, yes, at a big level, but at the local and personal level, Dr. Salil Bhargav, Commodore Raman Arora, our entire SETI team has been individuals who have propelled me to do many of the things that we've been able to do. There's no way we could have done this alone. So I'm very grateful to the team that we have and we have brought together, and Dr. Bhargav and Commodore Arora are many parts tremendously deserve credit for the work that SETI is doing today.
डॉक्टर सलिल, मेरा आपसे सवाल है, जब आप रात को सोते हैं तो आपको क्या बेचैन करता है, और आप क्या ख्वाब लेके सोते हैं कि सुबह में उठूं तो मुझे ऐसा मिले?
कमोडोर रमन, मेरा सिर्फ एक ख्वाब है कि मैं अपने जीवन काल में ही भारत को टीबी मुक्त होते हुए देख सकूं। यही मेरा सपना दिन रात का रहता है। इनफैक्ट मैं जब से एक जिला शय अधिकारी या डिस्ट्रिक्ट टीबी ऑफिसर रहा हूं, तब से हम लोग इस पे काम करते रहे, अपने जिलों में काम करते रहे, लेकिन अब आपके साथ, मनोज के साथ, सबके साथ, इतने सारे डीटीओस के साथ हम लोग काम कर रहे हैं। सपना सिर्फ एक ही है कि हमारा देश जल्दी से इस बीमारी से मुक्त हो जाए।
थैंक यू डॉक्टर सलिल, थैंक यू सो मच। एंड डॉक्टर मनोज, मैं अब आपसे रिक्वेस्ट करूंगा, lead the session towards its destination. Share your vision, share your dream, share your thoughts, and please speak to us through your heart. What is in your mind, so that everybody who is present here, and there are so many people who are listening to us live right now through YouTube. So we know that the government is not leaving a stone unturned. We know it. We know there are so many NGOs working. We know all the STOs, DTOs, everybody in the NTP, all staff are working together. There is no shortage of budget. The political will has never been stronger than what it is now. We heard the Union Health Minister also, and we heard the DDG that the society needs to come together. So with all these questions, of which I don't have so many answers right now, I hand over the session to you to lead it towards its destination. And in the meantime, I'll get in touch with Gurudev and bring him in. Please.
So thank you so much, Commodore Raman. Namaskar. Thank you.
No, you got muted, Dr. Jain. I can't hear you.
Sorry. Yes.
Yeah, please. Yes.
So I want to thank all the dignitaries that are here. Thank you, Dr. Joshi. Thank you, CTD team, who's been doing a lot of work. And hundreds of DTOs, TBHVs, and others who have joined. I have a dream. मेरा एक सपना है, और वो सपना है कि मेरी जिंदगी में, अपनी जिंदगी में टीबी मुक्त हो जाए भारत से, और दूसरे नेशन से हो जाए ठीक है, पर भारत से. I don't think many people realize that TB kills 1,000 people each day. TB causes illness to 25 lakhs patients each day. When I talk to people, sometimes they say, TB to, it's gone, there is no issues. But they don't realize that it is that hidden silent killer, which we need to remove altogether. So these number of deaths per day, the number of cases, they should not be happening. Why? Because TB is 100% preventable. It is a preventable disease. We do not need to be seeing these cases. And if we do all the right steps, we know that we can do that. And I have seen it, and I have worked with it and done that in many of my works over the past 30 years as an infectious disease doctor. I'm also a Parvasi Bharati, and I am proud of my Indian heritage. I want to share a bit of my personal journey as well. Yes, I was born in India. At the age of 10, my parents had moved to America, and that's when I went there. Over the past 50 years, I have been coming back to India, maybe once, maybe twice. Last year, I came 3 times. 3 बार मैं India आया last year. काय के लिए? हाँ, रिश्तेदारों से मिलने, शादी जाने, but also to work on TB. And what I do is I go to villages, I go to the poor areas. I look and talk to the people on the ground and see what is happening. And what I see is the following, that you know very well, that every other house, we will find a case of potential TB or someone who has been infected with TB. We know that there are easy ways to diagnose TB. We know that there are ways that we can treat TB. We know that there is a cure for TB. And yet we are not able to achieve that. So the mission has been that within our lifetime to eliminate TB. In this journey, about 15 years ago, started SETI. SETI was an organization which was a small organization, and we worked in working with individuals, district TB officers. So I say this all the time, that it is not there's only one person who can eliminate tuberculosis. It is not the Prime Minister, I'm sorry. It is not the Chief Minister. It is not the Health Minister. It is not the District Collector, not the DHO. It is only the District TB officer who has the wherewithal. He or she sees thousands of TB patients in a year. He or she directs a team of 20 to 50 people who are targeting tuberculosis. It is his or her effort that will determine if TB will be eliminated in a district. This is a conversation that Dr. Joshi and I had on multiple occasions. कि जो districts में अपन देखते हैं कि वो अपना जो district TB officer DTO progressive है, सोच रहा है कि वो आगे बढ़ सकता है, innovate कर सकता है, we know that they make all the difference. And so we have focused in on doing that. So today, we are gathered today here to ignite the hearts of all. Today, we are here to inspire the DTOs and the team with the DTOs. And we have the greatest inspirational guru in the world to join us. Gurudev Shri Ravi Shankar, who will be with us here soon. So this dream of making India TB free is not mine alone. Exactly 2 months ago, Gurudev came to our home in America. We talked for a long time. I shared this dream with him. We had a fireside chat. I heard about the number, Gurudev heard from me about the number of deaths that TB causes, the challenges with stigma that we face. Knowing these issues and knowing what the devastating toll that COVID had taken, Gurudev said that he would work with us. And he has. And over the years, he will continue in helping us. So Gurudev has joined in our efforts for TB free, but we will soon see also that Gurudev is working on a bigger, broader vision as well. How to be violence-free and a stress-free. We need to be thinking of a violence-free world and a stress-free world. And so that is part of it. So how will we do this? How will we become TB free? How will the DTOs do this? Here is my message to the DTOs, to the NTEP staff. We are in the last mile of the TB elimination journey. Yes, last mile are always the hardest. If you run, if you're a marathoner, you know what that last mile feels like. All resources are available, as we've heard. Political resources, financial, supportive are there for us. We look for inspiration, inspirational, humanitarian, and spiritual resources. And Gurudev is here for this. Yes, the hard mile is the hardest. As our Honorable Minister ne bataya, ki polio elimination apne desh ne kara. And it was very hard on that last mile, but it was very doable. And yes, I have done that. Now here's my message to the Art of Living volunteers. There are so many of them who have joined us today, and I am very thankful. मुझे बहुत अच्छा लग रहा है कि इतने सारे Art of Living volunteers and supporters are here, because you will help take this message out to the common public. What we have seen and you have done is battled COVID and natural disasters. If you look at the incredible work done by Art of Living, it is amazing. What I request is that you work with the district TB officers in your region, work with the TB team. And yes, we are tired and weary, but we still have work to do. There are a number of government programs that are there. We heard about the Nikshay Mitra program in adopting a patient. And yes, we are all doing that one by one. I know Commodore Raman has adopted a dozen patients and has had his friends adopt many, many more. This is the approach that we want to be taking. Several concepts that we have talked about today, but another one that I want to add in the minds, that TB is a local disease and it will be eliminated district by district. And so the responsibility of eliminating TB hangs on the shoulders of the DTO and the district's elimination of TB. Everyone can be supportive, but it is largely dependent on that individual district for improvement. What can SETI do and NGOs do? We talked about what the government is doing. We've talked about what DTOs are doing. We talked about what Art of Living is doing. I want to take a few minutes and आपसे share करना है कि क्या अपने SETI has done and what is doing. SETI has collaborated with API, a TB-free roadmap in 10 cities, and we have worked on thinking through strategies with the DTO and the team. That was about 4 or 5 years ago. More recently, we're part of I Defeat project with Union and USAID, and a program managers course that you've heard many people talk about as well. Also with Emory University, we have done a boosting TB notification project as well, where we have put and brought together hundreds of districts in working on boosting TB as well. And then through private trusts, we are working on a CAP TB, a comprehensive holistic approach of eliminating tuberculosis. You will be hearing more about this in the upcoming months as well. What and how do we do this? Yes, a small team is there, but there is a process improvement, a quality improvement approach that SETI is taking. SETI is working on what we call a PDSA, a Plan, Do, Steady, Act. बहुत सारे लोगों ने already इसके बारे में सुन लिया है और हम ये बता रहे हैं कि इसको अब expand कर रहे हैं. And we're looking in Madhya Pradesh even for going to the general medical areas and sharing the PDSA cycles with them. In America, every single hospital uses a Plan, Do, Steady, Act quality improvement strategy. We even have an electronic version which makes it all very, very simple. And so as I finish and I conclude, what I want to share with you is the following. There is a lot that we can do. And so I'm going to bring in Commodore Raman. And Commodore Raman, I want to talk about the following. I want to talk about this last mile. What will it take to eliminate TB? And I will put this proposition up that it will take dedication and passion, that it will take innovation and curiosity, no fear of learning and trying new things amongst our DTOs and the DTO team. It will take collaboration, working with the private sector, working with NGOs, and it will take inspiration like today. Yes, both giving and receiving inspiration. The DTOs may take in inspiration, but they may also give out inspiration. So I would love to hear from you, Commodore Raman, and then also hear voices of our DTOs of how these things and how have been important to them as well.
Absolutely, Dr. Jain. I am so much in agreement with you that it is only going to be dedication, passion, collaboration, innovation, and inspiration which will take us forward. So, and today, we have a mix of everybody here. The dedicated NTP staff, the DTO and STOs. Collaboration, you are there. There are so many NGOs who have joined. The government setup is there. The health minister was there. Inspiration, will be having it very soon through Gurudev. And innovation and curiosity is what we bring in. So let us hear from the DTOs, that innovative tool that we share with them, the quality that you talk about, the last mile connectivity that we are trying to bring into the program. What is the view of the DTOs so far? You said that, we have run a program manager's course. You said that we have run a comprehensive approach to elimination of TB project is running. You also mentioned that we ran a boosting TB notification program. So boosting TB notification, in fact, was, all across the country. And let's hear from those participants, what they have to talk. So may I request Edwin sir, next slide, and we'll hear Dr. Chandresh Vyas. He is the DTO of Junagadh, and he will talk of dedication and passion. Let's hear very short views so that the audience get the flavor of what is happening. Yes, please. You may like to do the audio and play it again, Edwin sir.
while he's doing that, I think it's really important. What we learned from the boosting TB notification was the following, that we have this ability to pilot, and then we were not sure that we could scale up the PDSA cycle. We didn't know if it would only work in one area.
Doctor to a medical manager. This course helped me a lot as a DTO, and this I become more conceptualized and manage the NTT program in better way. Thank you.
So, Dr. Manoj, here is a DTO saying that he transformed from a doctor to a manager. Okay, and it helped him, change his approach, which became more methodical and better. So, shall we play another? Take another
Sure.
view of a DTO?
No, absolutely. Absolutely. Let's hear more from our DTOs. And certainly we do a number of projects, the boosting TB notification, we do the I Defeat project, which is through Union and USAID, and we have funding from Emory University as well in many projects. But let's hear about from another DTO, please.
I'm very much thankful to the city team for their innovative ideas called in PDSA. With this, my tuberculosis notification has improved 10% in just 3 to 4 months. This helps in eliminating tuberculosis in my district by 2025.
Mr. Edwin, you can
I'm very
keep
much
going.
thankful to the city team for their.
And now we'll have Dr. Sood in Hindi.
PDSA tool सीखने का, और इस PDSA tool को हमने बहुत रियल लाइफ सिचुएशंस में यूज किया, और उससे जो है हमारे प्रोग्राम की परफॉर्मेंस में ना केवल बढ़ोतरी हुई, बल्कि एक साइंटिफिक टूल लेकर हमें और एक लर्निंग अपॉर्चुनिटी मिली, और PDSA tool सीखने का
मेरा नोटिफिकेशन वर्तमान में 106% चला गया, जबकि मेरा टारगेट 70% अचीव करने का था। पीडीएसए की वजह से मेरी लीडरशिप, मेरा कम्युनिकेशन स्किल, मेरा डाटा एनालिसिस सबसे ज्यादा इंप्रूव हुआ। मेरा नोटिफिकेशन वर्तमान में
100% तक 80% से 100% तक ले जाने में कामयाब हुए, और को 85% से 100% तक।
Notification of my district improved, and now on the top 5.
So as we see apologies for the video clips that have been cutting off, but the message from all of DTOs has been common, that things changed, and what caused that change was a new tool that was utilized, an innovation. But a tool is available. Kai baar kya hota hai ki things are available, but people don't use them. And what we are doing at SETI is making those tools more available and helping our DTOs achieve those goals. And it is the step by step that we achieve quality improvement. That entire PDSA cycle that is how it works. That is how we begin to improve care, reduce the number of deaths from TB, increase the notification, increase the sputum as well, examination. Those are all process measures that we begin to improve to achieve a TB-free. So, Commodore Raman, over to you.
Thank you, Dr. Manoj. And Dr. Salil, अगर आप मेरी बात सुन पा रहे हैं तो आपको भी मैं इसमें लेकर आऊंगा. So we heard, the terminology that has been used by the DTOs, innovative ideas. It transformed them into a manager. It transformed them into a leader. They learned data analysis from this tool. Now what we are trying to do, the same approach of PDSA. अब हम कोशिश कर रहे हैं कि अभी तक हमने DTOs को सिखाया और DTOs ने अपने नीचे वो तकनीक लगाई। अब हम पूरे देश के लेवल पे एक PDSA कर रहे हैं कि अगर हमें इस समस्या को सुधारना है, जो कि हमने रूट कॉज एनालिसिस किया है कि अवेयरनेस और सोसाइटी का अगर इसमें योगदान पूरा हो जाए तो इस लड़ाई में हम हमेशा 100% सक्सेसफुल हो सकते हैं। सो डॉक्टर सलील, आपके इसमें क्या विचार है? अगर हम पूरी सोसाइटी को इसमें इन्वॉल्व कर लें और उसमें पूरा अवेयरनेस आ जाए तो किस तरीके से हमारी लड़ाई को, ये चुनौती है, हम इस पे कैसे विजय हासिल करेंगे?
कमोडोर रमन, हमारा एक जो मुख्य चैलेंज रहता है कि कई मरीज लेट आते हैं। जैसे अभी कोविड के बाद हमने देखा हमारे अस्पतालों में जो मरीज थे उनको बहुत ज्यादा डिजीज थी और करीब 2-3 महीने से खांस रहे थे, लेकिन उनको आने में देर हुई, उनके फेफड़ों का डिस्ट्रक्शन हुआ। तो अवेयरनेस और सोसाइटी का इन्वॉल्वमेंट टीबी एलिमिनेशन का एक मुख्य हिस्सा आने वाले टाइम में हो रहा है। जैसा डॉक्टर मनोज ने बताया, दवाइयां हमारे पास है, पैसे की कमी नहीं है, डायग्नोस्टिक टूल्स हमारे बेस्ट है हमारे पास जो हो सकते हैं। तो फिर परेशानी कहाँ है? परेशानी सिर्फ इतनी है कि क्या हम उन मरीजों को सही वक्त पे नजदीकी अस्पताल में ला सकते हैं। आपने जैसा बोला कि आर्ट ऑफ लिविंग के हमारे जो नए मित्र आज हमारे साथ ज्वाइन कर रहे हैं, जो बहुत सारे अच्छे कामों को पहले ही करते हैं, और ये हमारे साथ जब जुड़ जाएंगे, आपके पास कोई भी ऐसा व्यक्ति मिले जिसे 2 सप्ताह से ज्यादा खांसी है या उसका वजन कम हो रहा है, जरा से भी ऐसे लक्षण मिले, तुरंत यदि हम अस्पतालों में लेके जाते हैं तो उससे बहुत फर्क पड़ता है। और यही चीज हमको हमारे फाइनल लक्ष्य, जो हमारे को टीबी फ्री भारत जो है, टीबी मुक्त भारत, वहां तक पहुंचने के लिए अब एक एक मरीज को, जैसे आप लोग अभी हॉकी देख रहे थे या फुटबॉल देख रहे थे, पॉइंट टू पॉइंट हर मरीज को, एक आदमी को, खांसी वाले व्यक्ति को हमको फॉलो करके और उसको सही जगह पर पहुंचाकर ये देखना है कि वो अपना इलाज पूरा कर ले।
Thank you, Dr. Saab. Thank you so much. Mr. Edwin, our IT HOD, may I request you to please play the introductory video of Gurudev. Gurudev will be joining us soon. The helicopter has returned. And, it is such a pleasure that he's made it. It is so inspiring. There is so much of love in these small acts.
And Commodore Raman, I'll say it was in the news that his helicopter had to make an emergency landing. And literally the news is unfolding before our very eyes with thousands upon thousands of people who are with us. And we greatly appreciate everyone staying with us. Apologies for having to extend longer, but I am sure you will be delighted to hear and meet with Gurudev.
This is an inspiration. Challenges will come. Challenges came to him also. And it's an inspiration that he's still joining us. So yes, Mr. Edwin, please go ahead.
In an era when ancient wisdom was buried under years of ritualistic practices, when games became wars and wars were played like games, a young boy was found in deep meditation in a quaint village in South India known as Ravi Shankar. He would say, "I have family everywhere. People are waiting for me." He astonished his teachers by reciting the Bhagavad Gita at a tender age of 4. With his education in Vedic literature and physics and his deep and profound knowledge of the spiritual world, he became one of the most prominent sages of the modern world. All through his life, he has been reviving ancient knowledge and creating tools and techniques that have benefited millions across the globe in living a deeper and a more joyous life. In 1981, the Art of Living was established by Gurudev Sri Ravi Shankar. Nurtured by his care and contribution, the Art of Living has rapidly grown across 180 countries, reaching over 450 million people. One of Gurudev's most unique offerings to the world is the Sudarshan Kriya, a powerful breathing technique that facilitates physical, mental, emotional, and social well-being. He has designed 57 exclusive courses that empower individuals and cater to the needs of a wide spectrum of institutions in the society. Back then, Gurudev started the Art of Living service projects by taking responsibility of reviving a sinking school which had no funds. Today, his intention has manifested in over 982 free schools, which provides education and food to more than 80,000 children in rural and tribal parts of India. During the COVID-19 pandemic, the Art of Living Foundation pioneered the I Stand With Humanity initiative, providing more than 80 million meals to the daily wage earners in over 170 cities across India. The service initiative during the pandemic included the distribution of 6,000 tons of food to 5 million families. It helped set up 7 COVID care hospitals and provided with over 200,000 PPE kits. Trauma relief programs were also conducted for more than 1 million migrant laborers and COVID warriors to bring mental relief. To combat the fear, stress and anxiety during such times, Gurudev launched the World Meditates campaign and also personally conducted online guided meditations twice daily, touching the lives of millions by bringing solace and keeping the hope alive. The Russian-Ukraine war created a surge of unrest around the world. In such regions of war, the Art of Living and IAHV shouldered the responsibility of housing the refugees and giving them hope.
A lot of noise and bombs, and we were very scary. In here, Art of Living helped me to find some place to sleep.
My son is very happy now here.
People here are very kind. They love us. It's our new home. It's really here.
Within 1 hour, 300 students they ate and 300 students they got the beddings to sleep.
The Art of Living, they are providing such a good food and accommodation. I really thank from my core of heart. They are treating us like their own child.
The magnitude of work included relief support in 9 countries, 32,617 meals being provided, 5,875 people were housed, 9,023 helpline calls were answered, 11,200 medical kits and 60,000 euros worth of medicines were distributed. 22,342 mental counseling sessions were conducted. 2,183 volunteers were on ground working tirelessly. Also, Gurudev himself visited Poland in 2022, instilling the message of peace and love.
I stand for peace. So you're all right?
I stand for peace.
Let's all stand for peace.
From childhood, Gurudev had immense faith in the principle of non-violence. With escalating violence and conflict in the world, Gurudev has brought peace in situations where war seemed like the only solution. Thousands of militants and Naxalites laid down their weapons and chose meditation in the northeast and other parts of India. His efforts include bringing an end to a 52-year-old fierce conflict between the FARC and the Colombian government.
Ojalá podamos los colombianos abrazar pronto el principio gandiano de la no violencia. Coincidimos con el maestro Shankar.
Gurudev has visited Iraq several times and addressed peace conferences to bring respite to the nation and its citizens. He has hosted a series of trust-enhancing interventions in Jammu and Kashmir, providing all the stakeholders to voice their opinions in an effort to restore peace in the valley.
I was named Muhammad, but after becoming a militant, I was called Khalid. We had been taught to operate guns, arms and train other youths. But now, after doing the Art of Living course and meeting Shri Shri, we realized we had chosen the wrong path. We now want to spread love and non-violence in Kashmir.
Gurudev's programs have impacted people involved in armed conflicts across the world, making him a global ambassador of peace.
We gather today in this wonderful occasion of tolerance, blessed by our Master of Love.
Gurudev strongly believes that behind every culprit, there is a victim crying for help. The Art of Living prison program is helping to rehabilitate the prisoners. It has reached out to over 800,000 prisoners globally and has brought immense transformation in their lives.
I used to actually look forward to fights. But now since doing this course, I'm a total different person. I can now walk away from a fight.
The Art of Living's Welcome Home Troops project has transformed lives and brought veterans out of aggression and depression. 94% of these veterans who were suffering from the unseen wounds of war reported peace of mind and reduced stress and anxiety levels. The Art of Living has also been working towards the betterment of the environment. 49 rivers and thousands of water bodies in India have been revived. Conducted more than 100,000 cleanliness drives. Planted over 81 million trees in 36 countries. More than 2.2 million farmers have been trained to adopt natural farming till date. Gurudev found the Shri Shri Rural Development Program Trust to empower rural India. Volunteers have developed thousands of model villages across India, providing solar energy to over 90,000 individuals under Light a Home project. Gurudev's vast global network of volunteers is well known for mobilizing trauma and disaster relief for the affected populations around the world. In a world torn apart by religious, social, national and cultural divides, Gurudev's vision is to see the whole world as one family. The World Culture Festival. The festival brought together over 3.75 million people from 155 countries with spectacular performances on a breathtaking 7-acre stage equivalent to 6 football fields by 36,602 dancers and musicians from around the globe, celebrating the diversity of all faiths and cultures. The Art of Living has hosted historic events leading to multiple Guinness World Records.
If you can have a mind of a scientist and a spiritual force of His Holiness Sri Sri Ravi Shankar ji gives, then we have a beautiful world and happy world and prosperous world.
And organizing a meeting no politician on earth could ever dream of.
The Art of Living Foundation. For 25 years it worked on programs promoting peace, combating violence and drug addiction, empowering our youth. It has an incredible following that cuts through all religions, cultures, and backgrounds. A very, very difficult thing to do in today's world.
Gurudev has been conferred with numerous awards around the globe, including the highest civilian award of Colombia, Mongolia, and Paraguay. The Padma Vibhushan, one of India's highest civilian award, and 23 honorary doctorates globally. His vision for the world is to see a smile on every face and create a stress-free and violence-free society.
The voice of peace, the voice of truth should be heard loud and clear.
With
Gurudev, Namaskar.
नमस्कार.
डॉक्टर मनोज बोल रहे हैं अमेरिका से, कैसे हैं आप?
हाँ, बहुत अच्छा है.
Are you doing well,
हाँ,
Gurudev?
I'm doing very well. आपने सुना होगा हमारा चॉपर डिले हो गया तो we had to do an emergency landing in
Yes.
a remote forest area where there was no road. और
Wow.
वहाँ के सारे लोगों को हमसे मिलने का मौका मिला। मैं उन आसपास के गांव के लोगों से बैठ के फिर बातचीत करके उनको प्रेरणा करके आए हैं, स्वास्थ्य के बारे में, सफाई के बारे में, और एजुकेशन के बारे में, एग्रीकल्चर के बारे में। और आपका ये जो मिशन है टीबी फ्री इंडिया, दिस इज वेरी 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 रिलेवेंट टू दिस कंट्री। जब 25 लाख लोग 2.5 million people are suffering from tuberculosis, we need to create awareness. That is for sure. And for TB, what is needed is cleanliness. Cleanliness is the first step. What I understand is tuberculosis spreads unclean hair and
Respirations, yes.
lack of proper hygiene. This has been our mission to bring hygiene, awareness of hygiene to people all over the this continent. And I'm happy to see that Dr. Manoj Jain is such a passionate person to bring health to the society. I've been to his home in United
Memphis.
States of America, and he's always been thinking about India and India's health, those sitting on the other side of the globe. And so everyone
Very nice.
thank Dr. Manoj Jain for his unceasing effort to bring awareness about tuberculosis. And all the other dignitaries present today, I know it is very late now, it's quite late and you must be having other things to do, but you know, sometimes nature takes us in a different route. So we have to be flexible for that, flexible. And I'm sure all the Art of Living teachers, volunteers around the country will definitely be part of creating better health and awareness to eliminate tuberculosis from our planet.
Very much so. Gurudev, we'll small just comments. Along with us are thousands of TB health workers, 700 over district TB officers. They work at the foot soldiers, state TB officers are there as well. And so I want to have a fireside chat conversation. जैसे अपन ने Memphis में, US में करा था. We talked about many topics. First, I want to begin with appreciation of all of the Art of Living volunteers and also the TB workers during COVID. As we know, they did enormous amount of work in saving lives. Your thoughts and the words of gratitude and appreciation for those workers, all of the people who are here, thousands upon thousands that are joined up in the call today, Gurudev. They are frontline workers for tuberculosis, and they were recruited to work on COVID.
I would say they are the soldiers. I see they are no less than a soldier. A soldier is in the border of the country to safeguard the country, and these are our workers, frontline workers, are like the soldiers against the disease. They are soldiers to prevent, disease entering into the human life. So let me congratulate them, and the entire country salutes you. People, the healthcare workers, especially during COVID, with the bravery with which you all work day and night, and the selfless service you have done to our country and to the population of the planet, is the best puja, is the best yajna that you have all done. So you will definitely ripe the fruit of this action that you have done. So be assured You have earned so much goodwill and good luck, both. Goodwill from people and good luck from God. You have got both. So I would like all of you to give away your worries. The Guru is there to take away your worries. That's all. I am here to, you give me all your worries. I want you to keep a big smile on your face and keep moving ahead. Continue the good work you are doing and inspire more people in this direction.
Very much so. Gurudev, there are a number of programs which the government has launched, and Dr. Rajendra Joshi, who is the DDGTB, the Director General, is with us also. And I would love to have him say a warm welcome to you as well, Dr. Joshi, for Gurudev, just a comment. And then also the TB Mukt Bharat Abhiyan program as well.
Yeah. Namaste, Gurudev ji. It is very
Namaste, राजेंद्र जोशी जी, आपको बहुत बहुत बधाई हो। आपने इतना एक बढ़िया मिशन हाथ में लेके, जैसे कई साल पहले भारत में स्मॉल पॉक्स के विरोध में अपने लोगों ने बीड़ा उठाया था, वो बड़ा सक्सेसफुल हुआ। इसी तरह से अब आप एक और मुहिम को अपने हाथ में लिए हैं। ये बहुत ही गर्व की बात है और आप अपने काम में यशस्वी होएंगे, ये मुझे पूरा यकीन है, विश्वास है।
Thank you, sir. So grateful to you for your Ashirvachan and support. I am sure with the help of all the people, Jan Bhagidari, we are able to achieve the ultimate goal of eliminating tuberculosis from our country. It is definitely possible. So, sir, we have recently launched, our Honorable President has launched a program called Pradhan Mantri TB Mukt Bharat Abhiyan, where what we call Nikshay Mitras, the donors, will adopt patients, and whole thing is online. They support both nutritionally and emotionally and give support to them so that the stigma is reduced, their nutrition is improved, and they get a feeling that yes, we are no longer outcasts, we are also part of the program, part of the community. So I'm very grateful that today's program is one of the very important things which will, I'm sure, go a long way in our goal of tuberculosis elimination, Guruji. Thank you very much.
Yes, lovely, very nice.
Wonderful.
बहुत बहुत बधाई और सबको बहुत बहुत आशीर्वाद, और जितने भी फ्रंटलाइन वर्कर्स है, वॉलंटियर्स है और पेशेंट्स है, आप सबको बहुत बहुत प्यार, बहुत आशीर्वाद। और ये याद रखिए, आप टीबी कोई ऐसी बीमारी नहीं है जो पहले लोग समझते थे टीबी आ गया तो बस दूर उनको गांव से उठा के फेंक दिया जाता था, लगता था कि वो मृत्यु आ ही गई है। अब ऐसा नहीं है, टीबी इज क्यूरेबल, वो ठीक हो सकता है, और ठीक करने के लिए सब लोग खड़े हैं, और बस इसको फैलने ना देना और आगे इसको बढ़ने नहीं देना, इसके लिए मुहिम उठाए हैं आप सब लोग। आप सब लोगों को फिर एक बार बहुत बहुत शुभकामनाएं और आशीर्वाद।
गुरुदेव, थैंक यू सो
सवाल
मच।
तो बचे हैं गुरुदेव, सवाल बचे हैं।
बस एक सेकंड में आपसे और इंट्रोड्यूस करूंगा माय राइट एंड लेफ्ट हैंड, कमोडोर रमन अरोरा एंड डॉक्टर सलील भार्गव, जो हमारे साथ काम करते हैं सब प्रोग्राम्स में। एंड गुरुदेव, वन क्वेश्चन फ्रॉम देम, एंड देन मुझे आपसे बस वही दो चीज़ें के बारे में और सुनना है, वायलेंस फ्री और स्ट्रेस फ्री सोसाइटी, और क्लैरिटी इन माइंड, प्योरिटी इन हार्ट एंड सिंसियरिटी इन एक्शन। ये दो चीज़ें आपने बोली, they have been very close to me since we have met and discussed. So I will have Commodore Raman say a few words, and then we'll finish up with those two things on how to better cope on those ideas. Thank you so much. Over to you, Commodore.
गुरुदेव नमस्कार। गुरुदेव, बड़ा सिंपल सा मेरे मन में एक सवाल है, जो मैं आपके थ्रू अगर मैसेज जाएगा तो पूरे देश में बहुत फर्क पड़ेगा। जो पेशेंट्स टीबी से ठीक हो जाते हैं, हम उनको टीबी चैंपियन बोलते हैं, और जब ये टीबी चैंपियंस अपनी बात अपनी कम्युनिटी में रखते हैं, दैट आई वॉज अ पेशेंट, आई हैव बिकम ओके नाउ, देयर इज नो स्टिग्मा, देयर इज नो प्रॉब्लम, देयर इज लॉट ऑफ गवर्नमेंट सपोर्ट, जब वो बात अपनी कम्युनिटी में रखते हैं तो बाकी सारे पेशेंट्स इनकरेज हो जाते हैं, क्योंकि 100 साल हो गए हैं बट हमारे देश में अभी भी स्टिग्मा है। तो ये टीबी चैंपियंस को हम बहुत प्रेरित करते हैं, सरकार की स्कीम भी है, पर ये टीबी चैंपियंस बड़े सिंपल बैकग्राउंड से आते हैं, बड़े सिंपल और हम्बल फैमिली से आते हैं, तो इनको कन्विंस करना मुश्किल होता है। मैंने कुछ दिनों पहले ट्राई किया उनके बच्चों से बात करना, और मैंने देखा ये बच्चे डिजिटली कनेक्टेड हैं, पढ़े लिखे हैं, यूथ हैं, इनमें बहुत जोश है, ये हमारे देश में क्रांति लेके आ सकते हैं, और ये कहानी बता सकते हैं कि मेरे घर में पेशेंट था, मेरे माँ बाप को समस्या थी, कोई चिंता नहीं है, आप सब लोग सामने आइए और उनको घर से लेके टीबी प्रोग्राम में अटैच कीजिए। गुरुजी, आपकी तरफ से गुरुदेव क्या मैसेज रहेगा यूथ को कि उन्हें क्या करना चाहिए, ये बीमारी लाइलाज नहीं है?
नहीं, बिल्कुल आपने सही कहा है, यही करना है, अवश्य यही बात करनी है। हाँ, आपने ये संक्षिप्त रूप में अच्छे से सामने रख लिया। हाँ, बहुत अच्छा।
बहुत अच्छा। Gurudev, thank you so much. And I know you have to go to another meeting and gathering, and your message of violence-free, stress-free society and clarity in mind, purity in heart, sincerity in action, we will take with us. Bahut bahut dhanyavad, Gurudev, and sparing time to be with us.
Thank you.
Thank you.
So with this, ladies and gentlemen, the majority, the main category of the program gets fulfilled. अब मैं आपको हैंड ओवर करता हूँ डॉक्टर सलिल भार्गव के सुपुर्द। डॉक्टर सलिल भार्गव और डॉक्टर मनोज, आप अपनी अब बातें रखें।
Very much so. Again, as we come to our closing, Dr. Joshi, बहुत dhanyavad. Thank you so much. DTOs, you saw that the greatest spiritual leader of our age, of our time, has spent time with us to discuss TB, to discuss the work that you are all doing, to inspire you and me and others to continue doing what we are doing. We are in the last mile journey, and there is no looking back. And I will say this, we are going to march ahead to eliminate TB. These are moments of inspiration. Dr. Bhargav, if you would, a vote of thanks, and then we will have the national anthem.
Thank you, Manoj. आज आप सबने गुरुदेव का आशीर्वाद प्राप्त किया। मैं गुरुदेव को धन्यवाद देना चाहूँगा। हमारे समस्त परिवार की तरफ से आभार व्यक्त करना चाहूँगा, जिन्होंने हमें एक नई ऊर्जा, अपना आशीर्वाद और मार्गदर्शन दिया, जो हमारे टीबी मुक्त भारत अभियान को एक नई ताकत देगा। मैं बहुत बहुत आभारी हूँ हमारे ऑनरेबल मिनिस्टर ऑफ हेल्थ एंड फैमिली वेलफेयर डॉक्टर मनसुख मांडविया जी का, जिनके नेतृत्व में मार्गदर्शन से टीबी प्रोग्राम बहुत तेजी से टीबी मुक्त भारत के लक्ष्य की ओर बढ़ रहा है। हम आपके बहुत बहुत आभारी हैं, आपने हमको आज समय दिया। मैं आभारी हूँ समस्त सेठी परिवार और सब लोगों की तरफ से, मिनिस्ट्री ऑफ हेल्थ एंड फैमिली वेलफेयर के समस्त ऑफिसर्स, डीडीजी टीबी डॉक्टर जोशी एवं सेंट्रल टीबी डिवीजन की सारी टीम, जिनका लगातार हमको सहयोग मिलता है, और आज भी उनका आशीर्वाद और सहयोग हमको मिला, जिससे हमारा सारा कार्यक्रम सुचारू रूप से संपन्न हुआ। आखिरी में मैं हमारे खास दोस्त लोग जो हैं, जिनके लिए हम बार बार बात कर रहे हैं, जो हमारे स्टेट टीबी ऑफिसर्स, हमारे डिस्ट्रिक्ट टीबी ऑफिसर्स, और उनसे भी खास हमारी जो टीम्स हैं, जो हर जिले में, हर शहर के कोने कोने में टीबी को खत्म करने के लिए मेहनत से काम कर रही है, उनका मैं बहुत बहुत आभारी हूँ। आज मुझे पूरी आशा है कि आज गुरुदेव के आशीर्वाद से आपको एक नई ऊर्जा का संचालन हुआ होगा, और आप अपने कामों को और तेजी से कर सकेंगे, और जल्दी ही हम वो दिन देखेंगे जब हमारा शहर, हमारा जिला, हमारा राज्य और हमारा देश टीबी मुक्त होगा। आखिरी में मैं आर्ट ऑफ लिविंग के समस्त भाई बहनों, इनका धन्यवाद देना चाहूंगा। आज आप हमारे हिस्सेदार कहूंगा, मैं अपना पार्टनर कहूंगा, आप टीबी मुक्त अभियान के आप हमारे विशेष सहयोगी बन गए। मुझे मालूम है आप लोग बहुत सारे महत्वपूर्ण कार्य करते हैं। आप सोसाइटी को स्वस्थ रखने में और अच्छी तरह आगे बढ़ने में सहयोग करते हैं, तो उसमें ये टीबी का प्रोग्राम भी आपका एक इम्पॉर्टेंट पार्ट रहेगा। आपको ये प्रोग्राम एक जरूर छोटा सा प्रोग्राम दिख रहा होगा, लेकिन इसको करने में सेटी की टीम और बहुत सारे लोगों ने हमें सहयोग दिया। WHO, गवर्नमेंट ऑफ इंडिया, एमरी यूनिवर्सिटी, आप ही के हमारे मेंबर्स और सर्टनली आर्ट ऑफ लिविंग की सारी टीम ने जो सपोर्ट किया, उसके लिए मैं आपका बहुत बहुत आभारी हूँ, बहुत बहुत धन्यवाद देता हूँ। हम ये प्रोग्राम अब खत्म कर रहे हैं, लेकिन इसके पहले मैं आप सबको आपसे रिक्वेस्ट करूंगा, अपने स्थान पर हम खड़े होंगे राष्ट्रीय गीत के लिए।
जन गण मन अधिनायक जय हे भारत भाग्य विधाता। पंजाब सिंध गुजरात मराठा द्राविड़ उत्कल बंगा। विंध्य हिमाचल यमुना गंगा उच्चल जलधि तरंगा। तव शुभ नामे जागे, तव शुभ आशीष मांगे। गाहे तव जय गाथा, जन गण मंगलदायक जय हे भारत भाग्य विधाता। जय हे जय हे जय हे जय 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 हे।
Thank you.
Ladies and gentlemen, we come to the end of this program. Thank you for being with us. Thank you for giving support to this initiative. We will make sure that entire force of this country comes with you, DTOs, STOs, all the NTP staff. We will make sure that we leave no stone unturned, that every citizen of this country becomes part of your team and helps you in doing the most wonderful, noble act in the health history of our country where you are involved. Thank you so much. Dr. Manoj, may I request you to say the closing remarks, and Dr. Salil Bhargav, if you have anything in your mind.
We are making history each and every day, DTOs, you, and with your work. This is the path to elimination. We are on that path. We're on that last mile. अपन जो चल रहे हैं, जो कर रहे हैं, वो अपने grandchildren and great-grandchildren will look upon us and say, thank you, thank you, thank you.
Thank you.
Thank you.